all of those things that offer them a sense of purpose, optimism, and independence, to remind them of how it feels to laugh and have fun again. And above all, to show them that hope still glimmers in the darkest hours. So, an occupational therapist. So, and part of her latter post, she also mentioned that a physiotherapist will help you to walk again, but an occupational therapist will help you put on your dancing shoes and dance the night away. We, as pharmacists, as drug experts, may add days to our patients' lives, but an occupational therapist will add life to their days. Both are needed to work collaboratively in order to give our patients the best care that we can give. So here are some of the positive feedback from the event. So it seeks to answer the problem of interprofessional barrier, this mind meld. They also enjoyed working with other healthcare professionals, working with other students, and meeting new people. For the panel discussion and the topics discussed, they were very relevant topics, and then it highlights the importance of interprofessional collaboration. It is very informative and interesting, and the learnings from the different insights from other professions were some of the most enjoyable parts of the event for them. So going back to the question I asked earlier, but revising it, on a scale from 1 to 10, how would you rate the care that you receive? This is where mind meld and interprofessional education comes in. When you ask a patient, how would you rate the care that they receive? If we all work together, closely together, we can get number 1 with the patient being happiest. Events such as MindMeld, they are important because this serves as a simulation. This serves as preparation before we all practice interprofessional collaboration. Some feel like they are not really ready to work with students from other healthcare professions, and they are worried about how they can contribute to the team since they believe that their knowledge and communication skills are inadequate. So through events such as MindMeld, this is a case competition. So this is just a simulation first. They can all work, discuss with each other, and from them they can know what their strengths are, what their vital role in the healthcare team, and they will also know what their limitations are. So I would like to thank all of you for listening, and if you have any questions, feel free to ask them.
Thank you very much, Ms. Yu, for sharing your time and expertise on the competition. I know it must have been hard for you considering your condition now. The IP itself is a very interesting concept, and having experience of interacting and learning with other healthcare students before graduation and before interprofessional collaboration is very crucial to all future healthcare professionals. As a pharmacy student living in a country where IP is not practiced, it is a very interesting concept to be introduced, and I hope it will motivate many other associations and individuals, so there will be more and more IP competitions or activities in the APRO region. Thank you again, Ms. Yu, and I would like to open the floor for Q&A session now. So if you guys have any questions, please type I so I can give you the floor. And if you are too shy to unmute your microphone, you can also type in your question. But from my experience, At first, nobody would like to ask the question. So if you let me, I would like to ask you one question about the practical organizing events. So in the pictures, I saw some of these. I saw there were a lot of sponsors sponsoring the Meld competition. So are there any tips on how to approach sponsors and how to successfully get the positive answer from them? Since in this kind of event, the interprofessional events, it's crucial to have as many sponsors as we can get. So if you have any tips or suggestions, can you please provide us? Thank you.
So thank you for that question, Ashley. So for the sponsors, I'm just wondering, can you see the screen right now?
Yes, we can see the screen.
Okay, so for the sponsors, we contacted them. First, we sent them a letter. So we made a proposal letter, and then we provided them some sponsorship packages, and then we sent it to them. We usually target those companies that are related to the event. So for example, this one, PGH is the hospital, Brex, that is our pharmacy review school. Then this is generics pharmacy, that is one community pharmacy here in our country. So for others, we sent them invitation letters to partner with us, and then we give them in exchange companies, then ask for their contact details and who to send the letter to, who to address it to. And then we have a template letter. And then after that we send them to that person, and then hoping for their approval. Thank you.
Thank you very much.
Was I able to answer your question?
Yes, it was very helpful. Thank you, Kathleen. And since we have no questions until now, can I also ask about the cases that are used in Meld? Are these real life cases that actually happened before? So yeah, that's my question.
So yes, as I mentioned, the CHDP is the one who gives the cases, who provides the cases. So because the CHDP, they also have a community that they adopt. They also have and then the cases, they come from different. They come from actual real life patients that they were able to encounter. Sometimes they do a little, combine them a little, but they are real life cases. Yes. Thank you.
Thank you, Kathleen. If you have any questions, please type I, or you can also type the questions that you have. We have one question from Dora. So
Yeah.
she's asking if the audiences are allowed in the competitions.
So prior to the event, we actually open a sign-up sheet through Google Forms. So in this sign-up sheet, there are two types. You can register either as a participant. The participant are the ones who are joining the competition, who will be included in the case discussions. And then you can also register as an audience. Sometimes if we do lack some participants, we actually ask from the audiences who are willing to who are willing to be a participant for the competition. Thank you.
Thank you, Kathleen. So related to that question, I want to ask the additional question regarding would the pharmacist pharmacy. No, I'm sorry. The pharmacy students in the UP, are they
Yes.
interested? How much are they interested in this event? And are they, do they really want to participate in the IPE event?
So since the main organizers are actually from the College of Pharmacy and College of Medicine, actually most of the attendees come from College of Pharmacy. We usually lack participants from the other colleges, which is one of the things that can be improved in the future. But from pharmacy, we usually have an overflow, as in more than half, around 75% of the audiences usually come from the College of Pharmacy. Thank you.
Thank you very much. I see no more questions or comments from the chat box. So thank you for attending the webinar, everyone. And if you're the staff of the member organizations and or interested in the interprofessional education, I highly recommend having a competition like Meld at a national level or local level or university level. And thank you again, Ms. Yu, for your enthusiasm. And that was all for me. And thank you all again for attending the webinar. Have a good night, guys.